Hi, this is Elliott Martin,
And I'm Becky Hatfield.
and we're coming to you from opposite ends of the country today to talk about Medicare
We're asking,
and answering all your questions related to Medicare so that way you can make an informed decision. This is the Medicare Navigators Podcast.
what if, Elliot, you were about to turn 65 and you're over here saying, actually, I'm not that healthy.
Mm-hmm.
I have pre-existing conditions and they're kind of serious. Maybe
Yeah.
you have um like MS or something where you
Yep.
need to take a biological drug and it's really expensive. Are you kind of I don't know. Is it bad for people that have pre-existing conditions? Is it going to be okay?
Yeah. So actually when it comes to when it comes to turning 65, there's actually no pre-existing conditions getting your Medicare activated. So you just want to make sure for Part A and Part B, you want to make sure you apply, 3 months in advance of your 65th birthday. And then as long as you're applying for a Medicare supplement within 6 months of your Part B effective date, then you have a guarantee issue. It's called no medical questions, no pre-existing conditions, no waiting periods for services. You're guaranteed the coverage. This is kind of the protections that were written into law when it comes to Medicare. Now, if you wait too long to purchase a Medicare supplement, yes, that's where you can get into trouble. Where, okay, I'm applying for a Medicare supplement. I started my Medicare a year ago, but I'm just adding on the Medicare supplement now. Well, most likely you're going to have to go through medical underwriting questions. The insurance companies going to want to pull your medical records and review them. And if anything comes back that they deem as a disqualifying pre-existing condition, they can deny you coverage or charge you more before they accept you. So it's best just to start everything, especially if you have pre-existing conditions, start everything at 65.
Mm,
Or leading into your 65th birthday, really. Take care of it ahead of time.
okay.
Yep.
That's really nice if you get on top of it, how even if you have something pretty serious,
Yep.
you can still get the coverage that you need and
Yeah,
it's no
absolutely.
big deal. Like my father-in-law has type 1 diabetes and he pays hundreds, maybe thousands of dollars a month for insulin. So I'm excited for him to be able to like get his insulin for less when he becomes
Yeah.
Medicare eligible.
Yep.
So
A lot of that insulin is now at I think a $35 a month max on certain insulin. So
that's amazing.
yep.
Yeah, I'm excited for him for that. Also, I wanted to ask you about if you were about to turn 65 and half of your friends are like original Medicare with a Medicare supplement and Part D for prescriptions. And then the other half of your friends are saying, "Oh, Advantage plan all the way." Like that's what I would go with.
Hmm.
How do you know which one to choose? Is the process of signing up for one is the process of signing up for an Advantage plan different than the process for signing up for original Medicare?
Yeah, the process is going to be different for the supplemental plans and the Advantage plans and the prescription plans because you've got to go to a private insurance company to purchase one of those. Whereas Part A and Part B, you set that up through the federal Medicare program. You contact Social Security, and it's just a standard benefit that you qualify for through that federal Medicare Social Security program. So maybe the main differences though between the traditional, you stick with the traditional system, adding on the supplement and the prescription plan, that's more access and freedom of choice and eliminating your out of pocket on that side. Whereas Medicare Advantage, a lot of them are HMOs, so it's more of a managed care system where you're narrowing down your network of providers. So that's one of the main differences to understand between the two routes. You may have friends that really like one option or friends that are over on the other camp. And it's just a matter of understanding, okay, what kind of access to doctors do I want to keep open? Do I need to keep things as wide open as possible? Or am I okay narrowing things down or um, or having to consider in versus out of network on the Advantage side. So that's kind of the
Mhm.
big picture difference between the two worlds. Um, as far as applying goes, I mean, it's just a matter of figuring out which company you want to go with, who's got the competitive plan, the lower premiums, the lower out of pocket, who works with my doctor. And then just it's a matter of, either contacting those insurance companies directly or working through an agent, a broker to get help getting those plans set up.
Okay. That's really, really helpful. Different positives to each side,
Yeah.
obviously, but I think talking to a broker is always a good idea just because they really know the market, especially in your area, because it sounds like Advantage plans are very geographically based.
Yes.
And so you have to know what's available in your area, in your county even.
Right, right.
So,
Yep. Yeah, it
um,
definitely helps.
so what would now you and I both are not in this situation because both of our dads are in steeped in the world of insurance, so they know what's going on. But a lot of people our age, mid 30s,
Hmm.
have parents that are aging into Medicare at this
Yeah.
point in time,
Yep.
and they do not know what they're doing. They're new to Medicare. They're trying to figure it out. Um, if you were a child of someone who was about to turn 65, um, what kind of things would you want to tell your parent that didn't know anything about Medicare or questions that you would want to ask them?
Yeah, so I think probably the biggest thing, and actually one of my friends, his dad is going to be turning 65, or not, no, he's already 65, but he's going to be retiring, I believe, sometime soon. And my friend and his sister, we all had a Zoom together, just because they wanted to understand and help their dad understand, how to make that transition and what to expect. So really, I think that, the biggest thing for if you're helping out your parents is to understand what type of access, I mean, not only for them, but for you as well. Because I do get a lot of phone calls from adult children who are helping their parents out, helping them kind of sort through their insurance, their Medicare, their doctor's visits, where they want to go to doctors, and just if they are coming up on that decision, just making sure that they understand the two different realms, the traditional Medicare system, which is more open access, or, before they join an Advantage plan, just understand what that plan is. If it's an HMO, make sure they understand, hey, okay, this is going to be your medical group of doctors that you've got to stay within. Okay. If something happens, as adult children, you're thinking about your parents. I mean, what happens if they go to a facility that you're not happy with? Okay. They were hospitalized, now they're at skilled nursing. And if you've ever experienced skilled nursing facilities, a lot of them may not, they're just not the most fun place to be in, right? So, maybe they don't have a whole lot of option to switch to a different skilled nursing facility, right? So you got to think about, I know it's not fun stuff to think about, but you just want to think about, okay, um, do we want to keep things as wide open as possible just so we don't run into those kind of horror situations? Or are we comfortable taking on that risk, right? It's, if you're helping your parents handle their affairs in the future, it's just something to consider before making a decision, because today things are going great. We're all healthy, no issues, but
Mhm.
for a lot of us that may not continue. There may be changes in health that we have to consider down the line, and just how we're gonna get access to care, what kind of access we're gonna have. So um, that's kind of the big thing for any adult children that are, maybe thinking about their parents and helping their parents out. Of course, if we can manage it, if it's within budget, we all want to keep our access as wide open as possible. You accomplish that by staying on the traditional Medicare system.
Yep, I think you are spot on. I think we need to have a whole nother podcast episode with like a family therapist that teaches us how to have those awkward conversations with our parents about
Yeah.
health related stuff, financial stuff, because I think it can be really hard as an adult child of
Yeah.
someone who's aging into Medicare, and we realize that the financial state of our loved ones, in the end, it actually affects us
Hmm.
too as their children. And so I think a lot of times people want answers to questions, but they don't know how to ask them in a respectful way.
Hmm.
And so I think it's just sometimes a tricky place to be in as an adult child of an aging parent. And so that can be a whole nother
Yeah.
conversation that we should have at some point.
Yeah. Yeah,
'Cause-
we should. And
Yeah.
sometimes it's almost easier, just like, when you have, I feel like when you have, I'm just thinking about my relationship with my dad, growing up, when you hear things from your parents, you're kind of skeptical of their advice. And sometimes it
Mhm.
takes a third party, kind of like a non-biased third party, to kind of provide that extra insight. So, for adult children, if you're having trouble having that conversation with your parents, or just figuring out what they have, a lot of times it can be good just to talk to a broker. Because the first thing that, if I talk to an adult child who's trying to help their parents out, is, okay, what do they have now? And a lot of times they don't know. They need to get the ID card. We need to figure out okay, where are things today, right? And then we're able to kind of help sort people through. Okay, here's what your mom has, right? Here's how it
Mhm.
works. Okay, here's the opportunities for them to switch, if any. Okay, and here's the price. Here's the kind of the breakdown. So it kind of sometimes it can take an extra party to help you navigate through that process, because trying to do it on your own, yeah, you can probably figure your way out, but it just helps to have somebody just help you get to the bottom of what's going on, right? And
Yeah.
troubleshoot all the issues. And I've had that conversation. I would say, I've been doing this 8 years. I would say probably 30 or 40 times I've talked to adult
Wow.
children who are handling their parents' affairs and trying to figure out what's going on. And
Yeah.
usually what happens, Becky, that I see, is the reason they're calling me is because their parents are going through some sort of medical crisis, and now they're trying to figure things out, and figure out what their parents have, why they can't get to this doctor, why they're stuck in this skilled nursing facility, why their premiums are so expensive. It's usually at a point where things are a little stressful. So it's good to have an understanding ahead of time, if you can, of what do mom and dad have? How is that going to work?
Yeah.
And that'll give everybody some peace of mind. I think.
Yeah.
Yeah.
I know. I hope that when I am in that situation where I'm older and my kids are, where I'm at right now, I feel like my dad is really humble about things and he's really open with me about things, about like where he's at and what his plans are for the future and
Hmm. Hmm.
all of that. But I hope I'm like that too, because I think it does give a lot of peace of mind when you kind of know like, oh, my parents are taken care of. They have the health
Yep.
care that they need, and
Yep.
I'm not in the dark.
Yeah. Yeah. Yeah.
So
Yeah.
I'm really, really thankful for that.
Yep.
Is there anything else if you were about to turn 65, Elliot? Is there anything else that you would be thinking about that we haven't talked about?
Try and give yourself time to take care of these things. We run this webinar on Thursdays, in a Medicare 101 webinar, and we get people that are planning things out a year in advance. And
Mm.
a lot of them say, I know I'm too early. I know I'm too early, but I just want to make sure I'm doing everything in ahead of the curve. That is great. If you can plan things out, start doing some research and reading up on Medicare, trying to understand this a little bit well in advance of your 65th birthday. That's my biggest suggestion. It's never too early. I mean, we've even run into people who are still 5 years out, who want to plan this out. They're thinking about their future. That is fantastic. I love to see that. And if people, life happens. If you just didn't get to it, that's fine. But if you do watch this and you're getting this message, start early. That would be my advice.
Yeah, I think that's great. I mean, I've been in this job for a year now, and I feel like I'm just now kind of getting to the point where I'm like, okay, I think I'm kind of getting a grasp on all of
Yeah.
this.
Yep.
It took me a whole year.
Yeah.
So
Takes
I
time.
feel, yeah, it's complicated. And so I think kind of studying up is always a good idea.
Yeah.
So,
Yep.
well, that's really helpful. I'm really thankful we had this conversation. I think it's going to be helpful to a lot of people. Thank you so much for joining us for another episode of the Medicare Navigators podcast. We have a weekly Medicare 101 webinar that we would love to have you join us on. Go to our website at www.martinmedicare.com to reserve your spot today. Please join us again next week as we continue this conversation. All information related to this episode is listed below in the show notes.